Okay, so I brought you here today because I want to talk about something that affects all Americans. Everyone at least once in their life experiences this. All ages, all genders, all races, everyone. And it's the process of drawing blood. Blood is very important for the medical community. Doctors, they can get anything, any information they need from the blood. It tells all different levels that are going on inside the body. And so it is very important for doctors for diagnosis. So I want to explain to you the process so that you know what to expect when you go to get your blood drawn, and then you also know if someone is doing the procedure correctly. That way you can kind of protect yourself and from any harm or risk you may experience. So, the very first important thing is hand hygiene. The person who's drawing the blood needs to wash their hands with either soap and water beforehand or with an alcohol-based hand sanitizer. They also need to wear protective gloves. If they're not doing any one of these things, then call them out on it because it is very important. You don't want to transfer any of the germs from the blood drawer to the patient or vice versa. So once you've established that they've used the correct hand hygiene, then you can start the procedure. This is a tourniquet. You start by tying it onto the patient's upper forearm. You want to pull it tight, but not too tight that it's cutting off their circulation. You first wrap it over the band and then under. And this just makes the veins pop a little bit for you. You don't want to keep it on for longer than a minute. It starts to constrict the blood flow to the arm, so no longer than a minute. You start by feeling with your pointer finger of the non-dominant hand in the middle of the arm, that's the best, and then you make your way to the sides to try and find a vein. If you think you have found a vein, it'll feel like a tube structure, and it's kind of has a little bounce, little sponginess to it. If you think you have found one, push down on it, and make sure you don't feel a pulse. If you feel like a little beating or a pulse, then it's an artery. You do not want to poke an artery. It will cause a little bit of pain and potential harm to the patient. So you want to make sure, and it also gives different results. So arterial blood and venous blood give different results for different tests. And there are certain times when you do want arterial blood, but it's a completely different procedure. So you want to stick. This is the procedure for drawing venous blood. So once you found your vein, you'll actually take the tourniquet off and get your equipment ready. You will need some gauze pads, an alcohol wipe, some kind of syringe attached to a needle. They also use vacuum containers, but for this demonstration I have a syringe, and then a transfer device and your collecting tube. You'll also want some kind of tape to wrap the wound afterwards, or some kind of Coban or something. So once you have your equipment all set up, you'll put the tourniquet back on. And once again, you want to make it tight enough to where the veins will pop but not too tight. You'll wrap it around and then underneath. And then you'll find your vein again. Once you found it, you'll take your alcohol wipe the area in a circular motion for about 20 seconds, and then you'll want the area to dry. You'll take your gauze pads. You want them in a spot that is very easy to get to. I recommend right above the tourniquet area where you're going to untie it. You'll need the gauze pads right after you untie the tourniquet. You'll get your needle ready. Make sure that all the air is out of the syringe. You don't want to have any air in there. You'll also want to make sure the bevel of the needle, which is just the tip, is facing upward so that when you get the needle in there, the blood will come a little bit faster, a little better. Once you're all set up, you'll take the cap off. You'll hold the needle so that your thumb is on the top and your other fingers are underneath. And you'll at a 45-degree angle insert the needle underneath the skin. You don't want to push too far because you can go through the vein and then you won't get any blood, but you also don't want to go just underneath the skin because you may not even get the vein. So just enough to get into the vein. You'll notice a little flash of blood in this little spot right here. Once that fills up with blood, you know you've gotten into the vein. You can start pulling back on the syringe. You also want to make sure, though, that when you're pulling back, that you're not pulling the needle out of the vein. So you've got to keep it really still while you pull back on that syringe and collect your specimen. Once you have all of the syringe full, you want to go ahead and grab those gauze pads, keep the needle still, and then grab that tourniquet, flip it off, take the needle out, and then put the gauze pad over the area. These needles have, almost all the needles have these safety devices where you just flip them down and then you won't poke yourself or the patient again. Ask the patient to hold on to the gauze pad while you finish up the procedure. You'll want to take this needle off and put it in a needle safety hazard bin. That way, again, you're not keeping the used needle exposed to anyone. You'll take the transfer device and put it on the end of the syringe. That way, again, you're not having any needles that you could accidentally poke yourself with. This inside there is actually a needle covered with a little bit of rubber, and that is going to transfer the blood from your syringe into your collecting tube. You just slip that right in there, and the blood will just go right into the tube. Take it off, invert it a few times to make sure the coagulant is mixing with the blood, and then you're done with that part of the blood draw. You just need to finish up with the patient, check the area, make sure they're not bleeding anymore. If they are, hold it down a little bit longer. Otherwise, once they stop bleeding, keep the gauze pad over it, and then just take your tape and wrap it on their arm. They just need to keep it on for about 20 minutes to half hour, and then they can take it off, and the procedure is complete. So that is how you get blood from a person for tests. I just want you guys to be aware so that you know what to expect and you know how the procedure is done correctly, so that you can protect yourself from any kind of harm that you may experience. Thank you for coming today, and have a good day.